Hello everyone. As the continuation of our last class, today I am going to discuss about the bacterial disease, that is the meningitis caused by the organism Neisseria meningitidis. Meningitis is an inflammation of the leptomeninges with the subarachnoid space in the meningeal region of the brain. So the bacterial meningitis can be generally classified into two types. One is acute or chronic. Acute, it is for a very short period, whereas the chronic means this is for a long period. The acute meningitis, where the onset of meningeal symptoms were over the course of only a few hours to days, whereas in case of the chronic meningitis, the onset of the symptoms will be for weeks to months. So the acute pyogenic meningitis, it is an infectious inflammation of the leptomeninges, which is mainly caused by the bacteria. Either the bacteria may be Neisseria meningitis, Streptococcus pneumoniae, Haemophilus influenzae, and some other organisms, and it depends upon the age factor. The meningitis may be due to mainly two factors. One is by any infectious agents and another one by non-infectious agents. So the non-infectious agents include any tumor in the brain and due to some medications or sometimes due to systemic illness or due to some any medical procedures which are done wrongly. And another one part is the meningitis caused by the infectious agents. So the infectious agents which are responsible for meningitis may be bacteria or a virus, maybe a parasite, or it may be a fungus. So this table shows the bacteria which causes meningitis related to the age group. So the age starting from 0 to 4 weeks, the meningitis may be due to Streptococcus agalacticae, E. coli, Listeria monocytogenes, and Streptococcus pneumoniae. So, starting from 1 month till 50 years, the most important organisms which cause meningitis are Haemophilus influenzae and Neisseria meningitidis. And the people more than 50 years, meningitis may be due to Listeria monocytogenes and Streptococcus pneumoniae. So, what are all the clinical conditions which are related to the bacterial meningitis means? So, the meningitis caused by Neisseria meningitidis and Streptococcus pneumoniae, it may be due to the immunocompetency. And the meningitis caused by Staphylococcus aureus, Enterobacteriaceae, and Pseudomonas aeruginosa may occur as a hospital-oriented infection. Whereas the meningitis caused by Listeria monocytogenes and some Enterobacteriaceae groups is due to their age factor. That is, the old age people may get these kind of bacterial meningitis. So, what are all the predisposing factors which are responsible for this meningitis means mainly due to their immunoglobulin deficiencies, that is, their antibody deficiencies, and then their complement deficiencies, and if they are undergone any splenectomy or asplenic conditions, and if they have already any acute viral infections, they may get very easily this meningitis. And if they are already affected by any head trauma, so they can be easily affected by this meningitis. So the epidemiology of meningitis, it accounts for an estimated annual death of 1,70,000 people worldwide, and about that, nearly in 1 lakh cases, the main responsible factor for this meningitis are Streptococcus pneumoniae and Neisseria meningitis. That is between the age group of children 1 to 23 months. In the year 1996, there was the biggest meningococcal meningitis outbreaks were recorded in West Africa. An estimated case of 250,000 cases were recorded, and about 25,000 deaths were occurred during that time. And in the year 1985, in Delhi, 6,133 cases with 799 deaths. About 13% people, affected people were dead. So all the isolates of Neisseria meningitis belongs to the subgroup. The natural habitat and reservoir of this organism are the human nasopharynx, urogenital tract, and the anal canal. Mostly 5 to 10% of the adults are the asymptomatic carriers of this organism. So here are the nasopharyngeal carriers of these organisms. The major mode of infection is by direct contact or sometimes by respiratory droplets from the nose and throat of the infected people. So the prevalence of meningitis is highest in the meningitis belt of Africa. The pathogenesis of Neisseria meningitis. This the bacteria reaches the intracranial structures in any of the three ways. That is, first one by hematogenous spread through RBCs and extension from the juxtacranial structures, and the third one by iatrogenic source. That is due to any hospital-oriented procedures. This image shows the various sources of infection by Neisseria meningitis. So the first one, it forms a basal skull fracture, and it can also be a responsible reason for otitis media, infection of ears, mastoiditis, dermal sinuses, and furuncles in the skin. And apart from this, it may also cause inflammation of the nasopharynx and also the pneumonia. In neonates, the responsible reason for this meningitis are gram-negative bacilli like E. coli, Klebsiella, and also by Streptococcus pneumoniae and other group B streptococci. Whereas in case of children and adults, the major factors are Haemophilus influenzae, Streptococcus pneumoniae, and Neisseria meningitis, and some other gram-negative bacilli. The next one, that is the pathogenesis process, which is given here in the steps. So once the host inhale the contaminated droplets, it starts to adhere into the nasopharyngeal mucosa of that person. Then it starts to invade it locally, and it spread from the nasopharynx to the meninges through the bloodstream. So directly along the perineural sheath of the olfactory nerve, cribriform plate to subarachnoid space. And in meninges, the organism are internalized into the phagocytic cells, and then they start to replicate and migrate to subepithelial spaces. So the organism finally needs about 3 to 4 days incubation period to start the transmission from to another places. The next one is the clinical features. Meningitis and meningococcal septicemia may not always be very easy to detect. In early stages, the symptoms can be very similar to flu, so we can't able to differentiate between the meningitis or meningococcal disease with the flu or other flu-like conditions. So they may develop over 1 or 2 days, but sometimes it may develop in a matter of hours. So it's important to remember that the symptoms do not appear in any particular order, and sometimes the person may be asymptomatic. Now, these kind of clinical features are somehow correlated with this corona infection. So, in case of infants and young children, the symptoms are high temperature, fever, possibly with cold hands and feet. So, continuous vomiting, and they won't able to take any food at all. So, high pitched moaning, whimpering cry, and they start to stare at anything, and their complexion will be very pale, and they have stiff neck, arched back. The baby may be floppy, may dislike being handled, and it's very difficult to wake, or sometimes the person may be very lethargic. The fontanelles may be tense or bulging. So in case of the older children and adults, it's very similar with a high temperature, fever, possibly with the cold hands and feet, and vomiting will be there along with diarrhea. Severe headache will also be there, joint and muscle pains, and sometimes there will be stomach cramps. So the neck stiffness will be there, so they can't be able to touch the chin to the test, and they are usually light sensitive, so they won't like the bright lights. They feel always drowsy. The patient may be confused or disorientated. So seizures may also be seen in some cases. Rashes may also develop. This slide shows the collection of sample, that is the cerebrospinal fluid, by the well-trained physician from an infected individual. So once the CSF has been collected, it has been further processed for bacteriological analysis. So for that, first the sample has to be centrifuged, and the deposits were taken for bacteriological analysis. So the analysis first starts with gram staining, and then the CSF has to be cultured in the selective medium like selective and differential medium like blood agar, chocolate agar, and Thyr-Martin agar. After inoculation, it has to be incubated for about 37 degrees Celsius for 24 hours. Whereas in case of blood agar and chocolate agar, it has to be incubated with 5 to 10% carbon dioxide. And after the incubation period, the colonies were examined, and it was again gram stained, and biochemical test has to be done, and it has to be compared with the results of Neisseria meningitis. And apart from these two tests, there is also the rapid diagnostic test or there. The first thing is the latex agglutination test and the Quellung test, co-agglutination test, and PCR test, which we have discussed earlier in the last presentation. Once the positive organism is confirmed, the treatment will be started by means of ceftriaxone or cefuroxime, and vancomycin will be there until the Streptococcus pneumoniae is ruled out. If Listeria is suspected, ampicillin has to be added. If severe penicillin allergies will be there, meropenem is used. Acyclovir is also has to be added if we suspect any viral infection. So the next one is the chemoprophylaxis. So the rifampicin is the drug of choice for 2 days. A single dose of oral ciprofloxacin or IV ceftriaxone is also effective. It can also be given to the close contacts of the suspected patients. So apart from this treatment and chemoprophylaxis, there will be immunization. So for infants, no need. The passive immunity from mothers will be there under 2 years of age. So no reliable antibody protection will be there. Then the quadrivalent meningococcal polysaccharide vaccine is also available. So the use of vaccine is strongly advised only during the outbreaks, not necessarily in all the conditions. So we will continue with another organism in the next session. Thank you.